Thank you very much, Makuda. Okay, we've got with us now Ashiri of Cameroon Coalition to Counter Tobacco. That's Mr. Ashiri Elvis.
Yeah, madam.
How are you?
Fine, thank you.
Yes. So the Coalition to Counter Tobacco, what does it do exactly? How's it going about its activities?
The Cameroon Coalition to Counter Tobacco is a non-for-profit organization which is made up of civil society organization and youth-led organization who come together striving towards seeing into it that Cameroon will be free from tobacco-related diseases. So we have a couple of activities, given that it's an advocacy group, because global tobacco issues are public health issues, like global public health issues. So we run tobacco advocacy with the parliament. Globally, we have support, and we use this data, which is collected globally, to influence policymakers, because if we notice today, tobacco is the #1 killer in the world. Tobacco kills more than tuberculosis, malaria, HIV, and AIDS all combined. But people sit behind and think that it's only these diseases that are harmful to humans. But statistics from the Global Adult Tobacco Survey, which is a survey that is implemented by the World Health Organization through the Framework Convention on Tobacco Control, which uses Empower. Empower is actually a model which is put in place. M means for monitoring tobacco use and prevention policies, and P for protecting people against tobacco use, O for offering help to those who want to quit tobacco use, W for warning on tobacco use, and E for imposing bans, and R for raising taxes. So this model, this is what we put into the Framework Convention on Tobacco Control to actually see into it that people reduce consumption of tobacco. But if we move into it, it's not just only a local issue, it is going global, because tobacco is a public health issue, and we cannot solve this problem just looking at things locally. The Global Adult Tobacco Survey is a survey that was run in Cameroon in 2013 and published last February 2015 in the presence of the Minister of Public Health. And this survey gives into it some details into tobacco use. Some people, when we talk about tobacco use, people are really confused. Tobacco use, we have smoke tobacco and smokeless. And when we go into smoke tobacco, we understand that 700,000 Cameroonian adults are smoking tobacco. in the smoke form, while 400,000 are using the non-smoke form. So we should not confuse when we see people.
Well, non-smoke form means what?
Okay, non-smoke means that the powder form, the form that is not
Like
being
snuff?
inhaled, yeah, like snuff,
Chewing tobacco?
hookahs, and the others. But these forms are not actually smoke. Like
Elvis, let's come back. Let's come back a little. You were talking about global. You talked about. I want to come down to the reality of our communities. Young people are smoking. What is your group doing to stop them?
okay, what we are doing, what we want people to understand today is that tobacco actually kills.
Yes.
Yeah, tobacco will kill one.
Do you give talks?
Yes, we give talks. We run sensitization campaigns because we are actually in partnership with the Ministry of Public Health, with